Hey everyone, and welcome to the FLATLINING Podcast from Fulcrum Strategies. I'm Matthew Handley, and with me is our president and CEO, Ron Howrigon. Ron, how are you, sir?
I'm doing well. Thank you.
That is good to hear. Springtime is here for me in northern Michigan, so it's nice that the snow is gone and leaves are coming up on the trees. So the great white north is not so white right now, which is quite nice. I'm sure it's much warmer down there where you're at in North Carolina, though.
Yeah, it tends to be that way, much warmer down here than what you guys get in northern Michigan.
Well, today we want to spend some time talking about a congressional hearing that happened on May 1st. And before your eyes glaze over, this is something that we had talked about previously, and it has to do with Change Healthcare. Ron, I know some of your clients are dealing with this undoubtedly because my clients are still dealing with some of this, where they have been unable to get paid because of the Change Healthcare cyber attack back in February. Well, Congress, both houses of Congress, had the CEO of UnitedHealth Group, Andrew Witty, on the hot seat, and I pushed him pretty hard. Even some of the Republicans, I was impressed that there was some bipartisan pushback against UnitedHealthcare over this cyber attack, as well as some other issues due to UnitedHealthcare's vertical integration, as one representative called it. Ron, I want to step back, though, before we talk about some of the highlights from the meeting and from the hearings, and talk about remind people what happened with Change Healthcare and why is UnitedHealthcare having to testify on behalf of Change Healthcare?
Yeah, so Change Healthcare was a company that acted almost, you could call it, as an electronic portal that connected a bunch of different things in healthcare. It could be everything from how prescriptions get filled and transmitted to your local pharmacy, how your doctor submits a claim to an insurance company, and then how that money comes back through. It's sort of this electronic clearinghouse, if you will. UnitedHealthcare bought Change Healthcare back in the deal closed in October of 2022. And so since that time, it's been under the ownership of UnitedHealthcare. And as I'm sure everybody in healthcare understands, there was a successful hack, an intrusion into the Change Healthcare system. And eventually, after being in the system for actually quite a while before it was noticed, those hackers put in ransomware. And that shut down Change Healthcare, which overnight shut down things like how pharmacies could fill and transcript prescriptions to how your doctor would get paid. So if you think about, the doctors, hospitals, pharmacies, et cetera, overnight you went from having revenue coming into your practice to having no revenue, even though you continue to have to pay your payroll and your rent and all of those things. And the hack, the elimination of Change Healthcare's services went on for quite some time, which created a huge problem within the healthcare system. And that's why the CEO of United was testifying, because people are wanting to know how could this happen, why did it happen, and why did it last so long?
Yeah, and it's interesting because in addition to that, which was the main setting for the hearing, you had Senator Elizabeth Warren stay rather on message for her and go after them for their what she called anti-competitive business practices. Mm-hmm. I know, Ron, I'm hearing from clients who are unable to send bills to patients because they weren't able to get EOBs from the payers that were using Change Healthcare. And what appears to have happened as well, and many people may not realize this, is that Change Healthcare didn't just affect UnitedHealthcare's claims, it affected every payer in every state that's using Change Healthcare as a clearinghouse.
Yeah, so even though United owned it, if a physician group used Change Healthcare as their clearinghouse, it cleared claims for Blue Cross, Cigna, Aetna, United, Medicaid, So when a physician group was utilizing Change Healthcare, that could be all their revenue, not just their United revenue. It would have been bad enough, given the size of United, if it was United, but it could be everything. And so think about running a business where suddenly your revenue gets turned off like a spigot. I think I saw somewhere that Change Healthcare handles 15 billion transactions a year, and touches roughly 1/3 of all the people in this country would have something flowing through Change Healthcare, a claim, a prescription, et cetera, which means they've got data out there, personal data out there. So it's to say it was big is an understatement. It's huge.
I want to play a clip now from the beginning of the hearing. This is Senator Ron Wyden, a Democrat of Oregon. He's also the chairman of the Senate Finance Committee. This clip's a couple minutes long, but he's pressuring UnitedHealth Group CEO Andrew Witty about government employee data that may have been leaked, as well as the fact that some physicians aren't able to get paid.
Are you in a position this morning to say whether the hackers stole data pertaining to U.S. government employees?
Mr. Chairman, thank you for the question. Like you, I'm extremely concerned about any patient's information, but particularly in the context you just described. So far, through the process of working through the data, what we've been able to identify is indeed a substantial proportion of people across the country's data could be implicated here. We do believe there will be members of the armed forces and the veterans associated.
When can you give us in writing the number of military personnel affected and your best assessment of who they are? Can I have that quickly?
I give you my absolute commitment. That is
a week?
Top priority. It will take longer than a week, but as fast as we possibly can, we will get that.
This is a national security priority, Mr. Witty. 2 weeks, I expect it.
We will absolutely prioritize that, sir.
All right. Let's talk about why things are taking so long, and particularly how hard providers are being hit, because they're paying the price for the failures that have been made on your watch. How much longer will a provider who sent in a claim for services delivered in February have to wait in order to be paid?
Mr. Chairman, thank you for the question. Our belief at this point is that claims flow across the entire country is essentially back to normal. Certainly from a UnitedHealth Group's perspective, we are paying claims as soon as they arrive. We're aware that other companies may not be paid
Providers
as quickly.
are telling me it's going to take until at least June to clear the backlog. Can you do that earlier?
We can move absolutely faster than that. And in the meantime, we are providing financial support.
When can you expect to have that cleared?
We believe the system is broadly back to normal. Now, if there are any providers in state who you'd like to refer us to, we can make sure that they are particularly
Practically
addressed.
every provider I bump into is waiting to be paid.
Those payments from United certainly have been made. We are caught up, and we continue to advance significant interest-free loans for others.
Will you commit to waiving deadlines for timely filings and appeals for claims until everything's back in order?
Yes, sir, we have already waived those.
Will you commit to paying meaningful compensation to each provider and plan whose business operations you disrupted?
So we're happy to engage with providers to discuss that.
Please send that to me in writing, how the compensation system would work. Let me mention one other area very quickly. I've been following your various comments, and consistently, your views seem to minimize the impact of your involvement. You say that UnitedHealthcare payments processing accounts for only 6% of payments in the healthcare system. My view is that's basically hiding the ball. In 2022, the Department of Justice said the change retains records of at least 211 million individuals going back to 2012. So how many people have actually been impacted? Where did you find those files? And what medical information was stolen? I need answers to those three questions. How many have been impacted? Where did you find the files? What medical information is stolen?
Mr. Chairman, thank you for the question. As I've said, that is very much a top priority for us to get to the bottom of. We're working our way through that. As of this point, we have not identified anything like medical records or medical histories. What we have seen is claims information.
But you don't have the logs that would show what data walked out the door, because we have been working to get that, and we haven't seen it. Senator.
So again, that's Senator Ron Wyden of Oregon, Democrat of Oregon, and the chairman of the Senate Finance Committee, talking to UnitedHealth Group CEO Andrew Witty, pressuring him on when claims are going to be paid. And I think, Ron, we heard Witty there kind of splitting hairs a little bit about when claims are going to get paid, because he specifically talked about UnitedHealth Group and not all of the other claims.
Well, the other thing to really unpack from all of this is what you heard was somebody who did a masterful job of threading the needle and dancing around issues.
Yeah.
I mean, this is somebody who, Witty's an incredibly smart man, okay? He's been well coached on how to answer a question without answering the question, okay? And just a couple of things to point out. So first of all, when they're talking about, how much has been stolen, et cetera, one of the things to point out is the hackers were in their systems for 9 days before they realized it. When you think about like somebody breaking into your house and trying to snatch and grab in the next 20 minutes, imagine somebody being in your house for 9 days. That's what they were in that system for. There's no way that they know everything that was taken because they had a lot of time to take data. So that's the first thing to point out. The other thing is there are a couple of things that really struck me is when he's answering these questions. When they were talking about, claims payment, he said things like, we believe that it's broadly back to normal. Our belief is that, that we're clearing the backlog. Things like, he didn't say it was back to normal. He said that it's cleared. He said it's broadly back to normal. So he leaves himself room there. When he said, well, will this be done in this way or 2 weeks or whatever, we will make it a top priority. We work very hard. So he's not committing to anything. When they talked about, well, are you going to compensate these people for their damages, which are like paying interest on this money that you held from them? We are interested in engaging in those discussions. Of course, they're not going to pay these groups, but they're interested in engaging in discussions. When they talked about, how many people it was, we'll make that our top priority. Also, it was interesting when he said, at this point, we do not believe that any medical records have been stolen. Well, it's an important thing that he's trying to say, oh, don't worry about your clinical information. Change Healthcare doesn't deal with medical records. It deals with claims. But what most people wouldn't understand is from claims data, you can get a lot of the information that you would get from a medical record.
Yep.
For example, somebody might say, well, I want my information protected. I don't want everybody knowing that I have HIV or that I have MS or that I have whatever disease. Well, if you grab the claims data, there's a diagnosis code on there that tells exactly what's wrong. Somebody might say, well, I don't want somebody to know that I am seeking care from a psychiatrist for depression or that I have a certain mental health diagnosis. Well, that code is on that claims data. So I thought it was really telling of him to go, oh, well, of course they did. That's not where they're housed. But they did steal potentially enough information to indicate things like, what is your condition? What are you dealing with? What are your health issues? All that stuff. If an insurance company paid for a woman having an abortion, that information is there. So I really personally, and I get it. He's the CEO of a big company. He's not going to come clean and go, yeah, we screwed up and man, it's bad. I understand that. But the skill at which he sort of deflected that stuff, from my perspective, it was a little frustrating because he didn't answer the question. And he tried to, spin it in such a way that, oh, don't worry about it. There wasn't medical records. Okay, there wasn't medical records, but there was a lot of clinical information in those claims that just got released.
One of the other senators that asked him different questions during this hearing was Senator Bill Cassidy, who is an MD and is a Republican from Louisiana. This one doesn't have a clip, but I thought I would point this out to you, Ron, that he asked Witty if UnitedHealthcare was too big to fail. And Witty said, interestingly, despite our size, we own no hospitals, we don't own drug manufacturers, and we employ less than 10,000 physicians. But then he went on to say, Ron, because we've talked before about they're one of the largest physician owners in the country. Well, we contract and affiliate with 80,000 physicians who voluntarily choose to work alongside our Optum colleagues. Again, talking about splitting hairs here, I think that this is a clear sign that perhaps United is too big to fail. Not only just with the fact they own that many physicians, which wasn't even really the question, but the fact that Change Healthcare failed and it took weeks for it to come back online.
Yeah, absolutely. And this was another one of those gifted, for lack of a better term, political speech or PR spin. Okay. First of all, he starts out with, well, we don't own any hospitals and we don't own any drug manufacturers. Now, they do own a massive PBM, but you're right, they don't own any hospitals or drug manufacturers. This whole idea of we employ less than 10,000 physicians is hugely, and I think, sort of false from the reality of things. Because then when he, like I said, when he went on to say, we contract and affiliate with 80,000 physicians who voluntarily choose to work alongside Optum colleagues. All right, they own Optum. Yeah. They're not colleagues. That's a subsidiary. So that'd be like me owning 3 companies and saying, well, I don't employ 100 people. Now, I own 4 companies that each employ 25 people. But me personally, I don't employ, come on. That's a shell game. United is the single largest employer of physicians across the country. To say that hospitals employ 400,000 physicians, well, that's not a hospital. That's not 2 hospital systems. That's thousands of hospitals employ 400,000 physicians. And then to try to hide those 80,000 physicians as they choose to work alongside Optum, that'd be a little bit like me saying, well, Matthew, you choose to work alongside your other Fulcrum colleagues. Well, no, you're not. You're my employee. And those doctors who work for Optum signed employment contracts. They sold their practices. So him trying to downplay just how big United is, I thought was really disingenuous. And I agree with you. This is one of those things about why they may be too big to fail, because, when something happens at that scale, it's problematic. And when it happens at that scale for healthcare, people don't get the care they need, physicians go under, and, to take it to the extreme, people could die. Some of these medications that couldn't get filled are hugely problematic. So, I just found that to be another skillful sort of PR spin.
And for the record, too, Senator Wyden asked about 2 weeks. And for the record, today is, well, the day we're recording, and even the day it comes out on Wednesday the 15th, we're at the 2-week mark. And I'm sure Senator Wyden has not gotten his answer on that one.
Absolutely not.
I want to go over to the House for a second. This was he went in front of several committees on May 1st. Andrew Witty did, of UnitedHealth Group, and this was in front of one of the House committees. He was questioned by Representative Buddy Carter, Republican of Georgia, who was who used to run retail pharmaceutical chains, and he asked Andrew Witty about retail pharmacies in particular, and whether or not there was too much vertical integration in UnitedHealth Group.
Let me ask you something. This cyber attack, and certainly this has had an impact. I believe that there was a member of your team who was at the Doctors Caucus maybe a couple of weeks ago, and made the comment that that they responded quickly to the pharmacies and got them back up and running. And I asked them to define quickly, and that was 2 weeks. Well, 2 weeks for a patient going out their medicine is an awful long time. I think we would all agree with that. Look, everyone, you, me, Democrats, Republicans, Independents, we all want the same thing. We want accessible, affordable, quality health care. And accessibility is being impacted by the vertical integration that exists in the drug pricing change and in healthcare in general. You can see with this chart right here, you're the largest of all of them. And that's fine, I get it. I know that this is a capitalistic society. But this to me is a direct conflict of interest. I want to ask you one other thing. Since the start of the cyber attack, how many medical practices and pharmacies have you acquired?
We've acquired just one medical practice in Oregon.
Just one since the start of the cyber attack.
Correct, and that was agreed. The transaction was agreed before the attack.
Okay, so if we look at the records, we're going to find out that what you're saying is that you haven't acquired any during the time of the cyber attack.
So we've acquired one medical practice in Oregon, and we've added 2 IPAs to our network during that. As far as I'm aware, those are the only additions that have occurred. And I just want to reassure you that any valuations or assessments of those businesses are based on the economics before the attack took place. We would never try to take advantage of this.
That was Andrew Witty talking about a physician practice they took over in Oregon. He was pushed about that in the Senate hearing as well. Ron, he says that they were trying to acquire it. It was being delayed. It was being delayed by federal regulators at the time, and they got it expedited because of the Change Healthcare attack. And I know when we saw that story originally, there was discussion about, well, how many more are they going to try and buy based off their own failure? And one of the things that I think is concerning people as well is the amount of loans that they've been handing out because of their own failure and what some of those repayment terms look like as well. What do you think?
Yeah, so a couple things. First of all, he is correct that they were in discussions with that group before the attack, and that the sale closed, after the attack. Now, the question really should have been to him, how many practices during the attack have you either come to terms with acquiring or approached acquire but won't close the deal until after? Okay, that to me is a better number. Because was there somebody who was saying, I don't need to sell, and then in the middle of the attack said, fine, I'll sell? Because these things don't close overnight. It takes months. So he's probably being accurately correct in saying they didn't acquire any, but I'd like to know how many did they enter into discussions with or reach an agreement on during that period, and did those groups feel like they had to because they weren't getting paid?
Right.
That's one there.
Yeah.
And I don't know that number, and he wouldn't give that number, to be honest with you, even if he were asked for it. He'd dodge it. So, that's definitely a piece to it. As far as the loans, my understanding is they are sort of graciously doing these as interest-free loans up until 45 days after they've confirmed that operations are back to normal. But part of the question there is going to be, well, two questions. One is, how long is it going to take for, like they said before, for that backlog to clear where they've actually got the cash? And then secondly is, well, are you going to pay them interest on or any sort of financial damages on what you created? I know a lot of practices who, because their revenue was shut down, had to dip into line of credits with their banks, et cetera. So they had to pay for that, for that cost of that money. Is United going to compensate into that? And the answer is no, they're not. They're not, absolutely not. Now, the other thing is, don't think they're incredibly magnanimous about offering these $6 billion of interest-free loans, because there's an awful lot of their business that they collected premiums on from their fully insured business. And so they had that cash and weren't paying out claims. And the first thing they do with that cash is they invest it. So it's not like, United is going to take a massive financial hit on all this free money that they loaned out. That money actually came from individuals and employer groups. And they were making money on the investment on that anyway. So, I'm glad they did it, and they should have done it. They should do even more of it. But it's not, it's not like that's this massive hit to them.
Let me ask you this, because I wonder if it wouldn't violate physician contracts or whatnot, but could this open up the UnitedHealth Group to class action lawsuits by physician groups because they own Change Healthcare and Change Healthcare caused them damages to their businesses?
Well, yeah, it definitely potentially could, either individual course of action or class action. I will tell you that I'm sure the United people hate the timing of this attack at the same time when the Department of Justice is already investigating them for antitrust violations and anti-competitive behavior. And I don't think the two are necessarily tied together, but it doesn't look good, and it adds more people that want to see the DOJ break them up because they're so big.
Which Senator Warren called for in the finance hearing as well, and she even asked him about the DOJ investigations that have been reported in the Wall Street Journal, and Andrew Witty would not respond even to a United States Senator. He wouldn't confirm whether they were being investigated by the DOJ, even though it's public reporting at this point.
Yeah, it's public reporting, and that's probably his biggest concern. I mean, he can sit through two hours of getting beat up by senators or representatives, and then he takes the private jet back to his home, and he's fine. That's not going to tank his stock price. And CEOs have had to do that in the past, and they'll appear contrite and everything. What really is the big concern to him is getting broken up by the DOJ, and that's why he wouldn't touch that one. He didn't have a well-spun response for that. The other thing, that struck me about this whole thing is, when he confirmed that he finally paid the ransom, $22 million. Okay. Now, to you and I, $22 million is a lot of money. Understanding that their company made $23 billion in profit last year. That's not 1% of 1 year's profit. That's 1/10 of 1% of 1 year's profit. So, I mean, that's a little bit like saying if somebody made $100,000 and you got a ticket for speeding, and that ticket was $100, it's probably not going to break you. Mm-hmm. Now, imagine if you did something so heinous that it caused all this damage to everybody around you, and you made $100,000 a year of income, and you paid a $100 fine for it. I mean, that's a drop in the bucket. And really, the question I wish I would have seen asked more is, why the hell didn't you pay it sooner? Yeah. You know, that's a small amount of money to get back up and running, and for some reason you decided to try to drag this out and not pay it to get your system back up to line. That really is bothersome.
Do you think that because of Change Healthcare and also because of the DOJ investigations, we're going to see Congress acting a little bit more against UnitedHealthcare, trying to tamper down on anti-competitive behavior? Or do you think that, I'm sure they've amped up their lobbying game, but do you think their lobbying game is powerful enough to kind of stave a lot of that off?
Well, the problem that their lobbying game has, and we saw it in the committee hearings. You know, if you're an elected official, never let a good crisis go to waste if you can get votes out of it.
Right.
You know, United is an easy whipping boy right now as we're going into an election year, because everybody hates insurance companies. And they really hate United now because of this stuff. So it's a great way for Republicans and Democrats to rally around, I'm for the little guy, et cetera. And so that's going to be a problem with their lobbying game. I would tell you that if I were UnitedHealthcare, I wouldn't expect any favors from Congress in legislation or support of anything. You know, the DOJ is a separate deal. You know, Senate, the House really can't impact that. They're going to have it on their own. But I would be surprised if United, until at least after the election, tries to make a large acquisition. Like, United tries to, if they tried to buy Humana's Medicare book, that would create all sorts of problems with Congress. Yeah. So they're going to try to keep their head down. They're going to try to take the body blows like he did when he went before Congress and survive it, and pray that the DOJ is not successful. Because like I said, right now, it's just, especially in an election year, it's way too easy to beat up on United because it's great for votes. And that's why we saw, Republicans and Democrats going after that guy, because there's blood in the water and that's good for votes.
Ron, I appreciate you sitting down with me today. I think we've gotten more analysis here on this hearing than, quite frankly, anything that was published anywhere else. Because as I mentioned to you in an email earlier today, it was talked about on... It wasn't talked about on cable news. It was talked about on some of the internet streaming news sites for maybe a couple hours, and then it kind of faded off into oblivion. And this is an issue that, I mean, obviously, like we said before, it's affecting my clients and your clients and all of our clients at Fulcrum Strategies and other doctors across the country. And I'm thinking that this might be we maybe could be entering a turning point when people are starting to get fed up enough that something will change.
Yeah, I'm hopeful. I mean, I think if United and if Mr. Witty are grateful of something, it's that the timing of this happened when we have other bigger news stories. Mm-hmm. We've got Gaza, we've got Ukraine, we've got a president in a criminal trial. We got more salacious things that are easier to get get headlines out of and great commentary out of than explaining to people what an electronic transaction is and why this is important, et cetera. So I think that's why it hasn't gotten a whole lot of traction. But like I said, hopefully people are going to get fed up enough about this that we can have some change happen.
Ron, thank you for your time this afternoon.
No, thank you.
Miss an episode of the Flatlining Podcast? Well, now you can read a recap. Just go to flatlining.net and look right there on the homepage every Monday for a written recap on last week's episode.